for that promised conversation on the impact of COVID-19 on Nigeria's health sector and possible ways of dealing with the emerging challenges. We are now being joined from our RISE Abuja studio by Professor Onyebuchi Chukwu, a former Nigerian Minister of Health, an orthopedic surgeon, and fellow of both the West African College of Surgeons and the International College of Surgeons. In 2014, as Minister of Health, he led the hugely successful fight against the Ebola virus disease outbreak in Nigeria. He's also a politician, having aspired to become governor of his native Ebonyi State. Professor Chukwu, good morning, and thank you for joining us on The Morning Show. Good morning, Prof.
Good morning.
Good morning, Prof.
Good morning.
Very good
morning,
to have you on The Morning Show.
Tundu, good morning.
Yes.
And Rufai, good morning.
Yes. Well, quickly, resident doctors have gone on strike. They served notice for about 2 weeks. They met on Sunday and said they would embark on a total and effective strike, and they've since gone on that strike, with the exception of doctors who are involved in the fight against COVID-19. The reaction of the government has not been too encouraging. What exactly is going on? How do you think that the Nigerian government should handle this?
Well, I think I'll be able to speak from both sides. In 1993, I was still a resident doctor, and I was the president of the Nigerian Association of Resident Doctors of Nigeria. So I've led NAD, and actually led them on a strike. And then I've also been Minister of Health, as you mentioned, and NAD had also struck when I was minister. And so I think I have a good experience from both sides, how it is. Yes, they're on strike, and they've reasonably made exception to those who are involved in treating people who are infected with the coronavirus. As of yesterday, the information I have is that it was deadlocked. From what I saw on TV, it seemed to me that NAD was not willing to continue with the negotiations yesterday, and so left the meeting rather unceremoniously. So there's a stalemate, and then later saw the Minister of Health appear on TV to say there is a risk of the resident doctors losing their job if they didn't return to work by this morning. I think dialogue should still continue. That is one. I think probably the government did not react enough when NAD gave the notice of strike. Probably considering the times we are in, government should have actually responded to them quicker than apparently was done. That is on the side of government. I don't know exactly what was the emotional gauge at the time the NAD decided to abandon the meeting, but because they did that similarly to me when I was minister, I've always told them that's not the best way, especially since many of the people who will be there, the Minister of Health in particular, are indeed your colleagues. It's never good, without warning, just abandon a meeting and walk out on them. I think that's where I was different when I was president of the NAD. I never disrespected my seniors, but I made my point. I was very firm, and because I was so educated, I could use words very well. So even at the time I was no longer a resident doctor, I met the minister who was there when I was president of NAD, and he was telling everybody publicly that, look, he still commended me because even though I was leading a strike against government at the time he was a minister, but that I was never rude to anyone. I showed so much respect, and yet I knew what I was doing, and I was firm. So I think it's always important for anybody who is on strike to still give respect to those in authority while maintaining your point. So at this stage, I think what is required is for the government to insist that a NAD should come to the table, and I believe that NAD also should reciprocate and return to the negotiating table.
Thank you, Professor, for that nuanced perspective. As you said, Nigeria has seen a long history of strikes by doctors. So my question for you, is it effective as a means of pressure to get the aims that are, recurrent? It's always about poor working conditions, low wages, old salaries. It's the same issue. And yet, the fact that it continues to reoccur, the fact that strike action is deemed to be necessary, shows that it's not particularly effective. I want you to address that, if there are other alternatives that you think. And also, is it ethical, especially now that we are in the middle of a pandemic? NAD has given as a concession that COVID doctors can continue working for 2 weeks, but that's quite a narrow concession. When 2 weeks lapses, if no dialogue is deemed fruitful, are they going to join the other resident doctors and down tools at a time like this? And obviously, COVID is not the only medical condition that Nigerians are suffering from. Doctors are caregivers. Is it ethical to down tools in this fashion?
I've never believed in strikes. Even at the time I led a strike, I have never believed in it. But then strike is when people become helpless, when they feel their employers are no longer listening to them, and the only thing that could be at their disposal is to stop work, and they abandon their work. So, one, it's not the way to go. Two, question of ethics is a relative term. Ordinarily, strikes are not ethical, but then if those who are working are not protected to help those who are sick, then it actually could be ethical in that circumstance, as long as while they're on strike, because one of the main reasons they gave is that they don't have personal protective equipment to care for those who are infected with COVID-19. In that case, it's actually ethical. So it depends, but on the surface of it, doctors shouldn't go on strike. Then on the side of government, actually effort should be made to always ensure that you maintain that channel for dialogue and negotiation with those in the health sector. Since they are also constrained to embark on any strike, government should also see it as a special duty to always get them to discuss at the round table. That said, however, this is something between usually two sides. And again, the makeup of those who are leading the two sides can also determine a lot of things. If those leading governments are not actually the type that are always up and doing, that could be something you count against government. On the other hand, too, you've had people who have led, doctors, including NAD, who having been able to exercise that much patience required of leaders. So sometimes they too could also be a bit unreasonable, So those are things that depend on people who are leading them. But ordinarily, strikes, ordinarily are unethical for doctors. Strikes should not be embarked upon by doctors. But in certain circumstances, they have nothing else to do, so they will go on strike. And in some circumstances, like I've just said, it could actually be ethical if they are protecting their patients.
Professor, if they're effective, considering that doctors keep going on strike, that would suggest that their terms are not being met.
Is there anything in Nigeria that is effective? Strikes are not effective sometimes because, in the end, which is what I was always against, government will go and promise something they know they will never do. And that is why you have recurring strike in Nigeria. You promise something you never do, and you are held on to those things you promise. On the other hand, too, you find that when people ask for dialogue, sometimes people don't take them seriously initially. Take, for instance, the current issue between ASU and the federal government. One would have expected that despite the strike, these negotiations should have continued. But you see what is happening now. As soon as the government is able to say universities can open, the ASU will say we are still on strike, and then it's only then they will then reinvite ASU for negotiation. That shouldn't be. In fact, this is the best time when none of the sides are really under pressure to sit down properly, even if it's going to take 5 different days to iron out those different sides. So what I'm saying clearly is that strikes have not been too successful. But as someone who was an activist in the medical profession, I'm so experienced. The few things that doctors have been able to advance, either by way of their welfare or by the way of improving the standards in hospital, virtually all of them came through strikes. So in some ways, they can actually argue that they've been so successful with their strikes. You can name them. Virtually everything they've gained came through strikes. That's the truth.
But if we have to get to a point where virtually everything we gain is through strike, isn't it an indication of the fact that things are not working? Because, you said doctors shouldn't go on strike, the government cannot exactly provide, they will promise things they can't provide. But we have other countries in the world. I hate comparison, but I like to bring it in. A country like Canada, the doctors at some points were even protesting that they are overpaid. When can we get to that point in Nigeria that doctors will have all they need and the necessary equipment? Because it's a cycle. I remember vividly, former health minister, Professor Isaac Oyewole, was, I think, the leader of the resident doctors at the University of Ibadan in 1983. He led a strike. Funny enough, he was health minister under President Muhammadu Buhari. A strike still happened under him. So it's a recurring decimal, and we want this to end.
Well, you see, the system is such that the Minister of Health sometimes can actually be helpless himself because he doesn't release money. He's not the one that would accept to begin to probably say, okay, let's have a new table for doctor salary. That is not his mandate. So he needs other people. He needs those in labor and employment. He needs the finance ministry. He needs the civil service of the federation. There are so many other stakeholders that the minister is just one of the players, as it were. And of course, ultimately, the president sometimes will have to be the one to take certain decisions. So that is why you could have led strikes like myself, Professor Adewale is what they call life member of NAD. I'm also a life member of NAD, meaning that NAD appreciated us for what we did for doctors. And then both of us incidentally eventually became ministers. And yes, NAD were also on strike against us, or even the Nigerian Medical Association. Yes, because the minister, much as he may mean well for his colleagues, is not the only player. So to go back to the question you asked me, when can Nigerian doctors behave like their Canadian counterparts? Of course, when the doctors are overpaid in Nigeria, I believe, knowing what doctors have done, I've been part of them, I've been active in the practice. Many times, doctors have donated their own blood just to save patients. I'm telling you. Sometimes they've dipped their hands, brought out their wallet, and paid for patients just to make sure that their patients don't die. The job is such an emotional kind of job that no doctor would ordinarily, except if he's gone insane, no doctor would watch his patient die when he can do anything to save that life. That is just the truth. So I know that doctors have actually been people who have used their own resources to help people who ordinarily should just be expecting them to take care of their medical needs. So the point, if you listen even to the current Minister of Labor and Employment speak yesterday, you see, he, of course, as a minister, he has to show some responsibility, but he almost was blaming some other people for what is going on. Take a look again. Take that video clip and listen to him. He was virtually blaming some of his other colleagues that they are the ones who caused this embarrassing situation. So sometimes the Minister of Health will mean so well, and yet his hands are tied because he needs to actually work with others to do things. But that is where also I expect that the doctor should also understand with their colleague who is actually there to help them, because no matter what, he's the Minister of Health, but certainly he's still a doctor and he will always know what they're saying. What is important in this particular strike is that nobody, not even the Secretary to the Government of Federation, nor the Minister of Labor and Employment, nor the Minister of Health has denied that the residents do have some point. Actually, they have a reason to be on strike this time. They've all acknowledged that something went amiss, but they've tried to explain why. Like the Secretary to the Government of Federation said, yes, we have decided that we're going to pay some special allowance to those looking after COVID-19 patients. But soon after we took that decision, we found out that the government will not be able to sustain what we had agreed on. And so we needed to renegotiate, and we're just concluding that renegotiation with the labor unions and professional groups in the health sector. So they have acknowledged that there was a reason for this strike, but probably what has not used is that now there's a confidence of trust That's what I can imagine. There's a confidence of trust between the doctors and government, where the doctors are saying, okay, the last time you promised, you didn't do this, so now it is for money for hand, you know, and so on and so forth. So what I'm seeing now is that there's a lots of crisis confidence, lots of confidence, you know, in the government. So I don't know how government can reestablish this confidence, but I think since the minister said his colleague in finance said they are now already paying, what the doctor should quickly do, once a few of the doctors have started receiving, I think they should go back to negotiating table. That's what I think.
Well, Professor Chukwu, I mean, one of the lessons of the COVID-19 pandemic is that it has exposed the fragility, the inadequacy of the health infrastructure in Nigeria, or if you like, the entire sector itself. Now, post-COVID-19, what do you think should be done to upgrade the health sector and to show that we have learned the appropriate lessons in terms of how our inadequacy has been exposed?
Anything that we must expect to be done post-COVID, which we have started seeing the signs now. I'm actually a bit disappointed. Yes, I'm a member of APC, but I'm disappointed really that we thought with what has happened with COVID-19, laying bare, as it were, the state of our health sector, that the government will have clearly shown everyone. In fact, the actions of government will have told everyone that, look, we have realized the problem we have. There has to be something different, but not much. Apart from the credit line that was opened by the central bank for granting loans to those operating in the health sector, particularly those in the pharmaceutical industry and those who run hospitals and clinics and other service points. I've not seen much to suggest, because look at the budget. I thought, even as we are reviewing the budget, the priority will have shown where we are today. That hasn't shown. It doesn't. If you go through social media, the government is being made caricature kind of, because it seems we've not learned anything, even while we are in crisis. So if someone has not learned anything while during war, is it the post-war you expect that you have learned any lesson? So that is where we are having a problem. This is the opportunity for government to have shown clearly we should have reviewed the entire budget and move money. You see, I was in government, and the problem is that everybody wants to have money to spend. Even when I was in the Ministry of Health, every head of department, irrespective of what the government of the day said, look, this will be a priority, but everybody wants to spend money. That shouldn't be. Strong leadership means we should insist that, look, this is our priority today. Maybe tomorrow the priority will shift to other sectors, but for today, these are the sectors that have our priority, and therefore we channel the bulk of whatever money we have for the budget into those sectors to let the whole world know, for now, this is the priority. That hasn't been done. And until that is done, it's a risk for you to begin to expect that anything is going to happen post-COVID. In fact, we're all human beings. 100 years ago, the world experienced a similar pandemic where were lessons not learned, because there's a penchant. You know, there's a propensity for the human being, as soon as it's out of a crisis, to forget all about the lessons that were supposed to have been learned. They will note the crisis, but they were not learned. So that is the problem. So since human beings kind of either have selective memory or amnesia, and since human beings tend to forget within a relatively short time, even within a generation, I think the best thing is always to begin to implement things you hope to implement after the crisis. Begin to show what you can do after the crisis. That you will continue after the crisis. So that's why I'm not expecting much after the crisis, to be honest.
Wow, that's a grim prognosis, Professor. I mean, I don't blame you for coming to that. With the budget revision that Dr. Abati referred to, it was explained to the public that those cuts, I believe it was 42% to healthcare, was through no fault of the federal government, and that it's a statutory requirement. It's 1% of the consolidated revenue fund, and that this huge reduction is due to our overdependence on crude oil. But surely there has to be creative ways in which to fund primary health care, such that we do not have this kind of embarrassing... Already the healthcare sector is woefully underfunded. This is just embarrassing. And then earlier in the show, we were talking about DFID in the UK, and we really need to read the writing on the wall. A lot of the grants that we rely on may not be forthcoming in a post-COVID world. And I read your articles or your interviews that you gave on the onset of the pandemic in Nigeria in March, where you were less than impressed with preparations that have been made. What is your take on the whole handling from federal government level and states of the whole pandemic at this point?
There's no doubt that so many people who are in charge today, the authorities, they are working hard to contain this pandemic. There's no doubt. I wouldn't be fair to them if I said they are not working hard. But there is also a difference between working hard and then working purposely. I think the NCDC has done well, knowing where we started from, in terms of ramping up facilities for testing, but they've not done enough. They've done well, they've not done enough. I mean, if your child used to score an average of 20% in his subjects in secondary school, and suddenly he begins to score 40%, I mean, first, congratulate your child, commend him, compliment him, but then let him know that it's still not enough. So that's where we are on some of the things. Then one area that is so much glaring to many people, I don't know whether other people are seeing what I'm saying. I don't think we're able to mobilize our people to believe in what we're saying. When we started, and I'm sure Doc will remember this, when we started, because I remember Doc even at the time was wondering the way I was going about telling Nigerians the way the situation was, whether this may not be frightening to Nigerians and even make them to begin to panic. And I said, well, Doc, the first thing I'm trying to do is to get people to trust government again. Because over the time, those who have been in charge of government have made Nigerians to lose trust in government. I remember when we were still up to early part of our secondary school in the 70s, once the head of state or any military governor said so, people believed them. But over time, gradually, no matter whoever said anything, people just said, don't mind them. What do you want? What are you expecting? They will say it, they won't do it. So there's no doubt, if truth be told, that over time, it didn't start today, the populace, Nigerians have lost trust in their government. So when we started the battle against Ebola, that was what I made. I would say something, and even the media would say, it's not what they always say. But I also noticed that gradually, with each passing day, both media and people began to believe in me. To the extent that people will say, has the Minister of Health said anything? Once the Minister of Health not saying, in the social media they were saying, just relax, wait for him to say it. They know he will tell us the truth. So the first thing, we need to rebuild that trust. Right now, there's so much cynicism, not in favor of government. Why are people not wearing masks? And yet government says it is mandatory. Why are we not wearing masks? People are not. Less than 10% on the streets. Not only in Abuja or Lagos, but everywhere. It's even worse in the hinterlands. What is the problem? So instead of appearing on TV, facing media 5 days in a week, my suggestion would be do it twice, release whatever important information you wanted to release to the Nigerian populace. You don't have to appear to release whatever information, but can we begin to address certain segments directly? Let them see that government is serious. And then let also people show they are serious. When some of us who are supposed to be leaders don't even wear masks, who will believe you? When some of us organize activities and we don't obey physical distancing, and we are now telling people do both physical distancing and social distancing, why must they believe us when we are not practicing what we preach? And now these days, because I think also we're not showing strong leadership. In my time, we showed extremely strong leadership. It's not everything that comes from abroad that is right. There's politics everywhere. Public health and global health is full of politics, like anything in life. It's full of politics. And I don't think it's sense that are running all these pharmaceutical companies. They too are not really sense. They mean well, but they're not up to sense. And the bottom line is to make your profit and whatever way you want to sell your goods. So there's a competition amongst the pharmaceutical companies, amongst the various countries that own these pharmaceutical companies, for who will eventually produce the the silver bullet that the whole world will begin to buy, and they will make their money. So during my time, not everything we just agree with them. And I quarreled with some of my classmates, medical school classmates who were abroad. I quarreled with them because they were always saying I should talk to FDA, which is the regulatory body in US. And I say, I have my own regulatory body in Nigeria called NAFDAC. I was always asking NAFDAC, can I do this? If they say don't do, I will not do it. But people are telling me FDA. I say, no, it's NAFDAC. As Minister of Health, if I said NAFDAC said something and I did what NAFDAC said, I'm okay. Nobody will blame me. But if I go and tell anybody that NAFDAC said I shouldn't do something, but because FDA said I would do it, I did it. Of course, everybody have a cause to ask me to resign immediately. Okay. So there are things. For instance, I'll give you an example. Sorry?
Right, just give the example before I bring this new insight in, because time is not our friend.
Yeah, I'll give you an example. I've seen how the media is awash now with the fact that they did a study, which is not yet completed, but they're almost completing it, but they've not published. They did a study in UK and found that one of the steroids in the classification of corticosteroids, called the dexamethasone, can really reduce mortality, which is significant, as much as 30% in those who ordinarily will have used ventilators. That means severe COVID-19. But I don't know what we are making noise over. I think NCDC should begin to encourage, and the Minister of Health, both NCDC and Minister of Health, should encourage our people manning our treatment centers to begin to tell us what they are doing. Because I know for sure that some of the treatment centers in Nigeria are already using corticosteroids for severe COVID-19 before even the British people started talking.
I can imagine.
And yes, some people are saying that we should wait for WHO. What is WHO? We are part of WHO. We are the ones that feed WHO with information. Can Nigeria feed WHO with information so that WHO can take decisions?
Okay, Professor Chukwu, I just quickly want to give this insight. Health is very important. I mean, the American economy is worth about 20 trillion, close to 20 trillion, and the healthcare sector is about 3 trillion. But the silver bullet that will do anything as regards healthcare in Nigeria is the National Health Insurance Scheme. What happened to the National Health Insurance Scheme in this country?
Well, it has to do with continuity in government. It has to do with continuity in government. This idea that once people come to power, to office, they don't go through the files and see, in fact, fruits that are already rotting on the ground, not even low-hanging. I say these are fruits that are already ripened and are just getting rotten on the ground. They should just pick them, for goodness sake. Now, it took us almost the whole time since we gained independence until when President Olusegun Obasanjo came on stream for us to start some kind of government's national social health insurance scheme. That's the National Health Insurance Scheme. It took us so long because we were always not continue. But it was, I commend former President Obasanjo for taking it off from the former head of state, General Absalom Abubakar, who first started making the law, and he took it. That's what continuity in government. Then when I joined President Goodluck Jonathan, we decided that we wanted to make this mandatory. We also ensured that working with the National Assembly, we got the other thing that was started by President Obasanjo and Professor Yita Lambo, who was Minister of Health, which is the National Health Act. We took it up. That is, again, good practice of continuity in government. But nobody worked on the aspect of universal health coverage in terms of making health insurance mandatory. We had a presidential summit to which both the executive and the legislature, represented by the Senate President, committed to it. And before I left office, we had actually started working on different committees to begin the implementation.
Thank you very much, Prof, for joining us this morning.
Thank you, Prof.